now with what you need to know about back pain. 1 in 4 people face burning, aching, or shooting back pain. And ABC News medical correspondent Dr. Darien Sutton is here to break it all down. So other than falling asleep in your kids' bunk beds, what are the main causes of back pain? That's what always does it.
That'll do it.
Sleep position is definitely one of them, but the most common causes, which brings people into the emergency room, includes what you would expect: the sprains, the strains, sometimes even stress. But I think one of the most popular topics that patients talk about is, do I have a slipped disc? And that's what they want to know about. So I think it's helpful if we just understand what that looks like. Eva, I talk to you about this a lot. I show patients pictures.
Are you complaining, Eva?
I saw Eva perk up. But this is what a slip disc is. So we have our spine. It's a bunch of bones stacked on top of each other. That provides us support and protection of our spinal cord. And in between each bone is a cushion. That allows for flexibility. And there are times when that disc, that cushion, can push out or bulge out or herniate, pressing on nerves. That can cause symptoms. If it's in our neck, symptoms in our hands. If it's in our lower back, that can cause symptoms in our lower legs.
It's all
lower
serious
because if you have upper legs.
ankles, it's your lower leg. When is back pain something that's even more serious, and what can people do?
Most important question: when do I have to see a doctor? When do I need to go to the emergency room? So if your pain has been lasting for a week or longer and it's brand new, that certainly needs a workup. If you have numbness or tingling radiating down your legs, it can be something like sciatica, a very common cause, but you need to be evaluated. And some red flags to pay attention to: if that numbness is associated to weakness, if you notice that you have a fever or a headache, that could be an infection, or if you have numbness in your groin area, or if you're constantly running to the bathroom, this can be a sign of an emergency that requires emergent attention.
You don't want to play with that.
Okay, prevention, treatment, what can we do?
Very simple. Things that we need to do. Everyone should be stretching. Rhiannon is displaying
yes.
beforehand.
Wait, this way.
My opposite.
Oh,
the other
way.
way.
This
You
way.
got it.
There we go.
Fantastic. Rhiannon is our display model here today. She's stretching. These are stretches we should do each and every day. And before you even wake up in bed,
feels good.
try bringing your
does
knees
feel
to your
good.
chest and rotating your at your waist. This can also
Before you
help
get out of bed?
Yeah, before you get out of bed. And then in general, in terms of treatment, obviously over-the-counter medications, you want to start with something very benign. Start easy, easing it up, talking about physical therapy. And we recently discussed that new international study that showed modest benefits for spinal injections. So I don't want to cross them off the list, but you want to make sure you exhaust all the other possibilities before you go to interventions that could unfortunately raise your risk.
Wrong size shoes can also mess you up.
You're absolutely right. Pay attention to your footwear.
The doctor's assistant right now.